just start. So welcome to those who have just joined. So this is a webinar that we're running through the Specialist Centre for Public Health and the Specialist Centre for Social Care to support people applying for NIHR Personal Awards, so their Career Development Awards. And I'm sure some of you will know we've run 3 webinars already on the 3 different levels of awards, so the Predoctoral, the Doctoral and the Postdoctoral. And then for the session today, we're covering some things that are sort of relevant to whichever award you're applying to. I don't think I introduced myself, but I'm Louise Hayes. So I'm based in Newcastle at the Specialist Centre for Public Health there, and I'll let my colleagues introduce themselves as they join. But we've got Laura Tucker from the Specialist Centre for Social Care, who's going to do some kind of general advice about liaising with your employer and some of the sort of practical things to think about when you're first thinking about applying for one of these awards. My colleague Tracy Johns, who's going to talk to you about public involvement, and Lauren Hall, who's going to talk about research inclusion. So we're aiming to talk for not too long, maybe no more than half an hour, so that we've got time at the end for questions. So do please put your questions in the chat or have them ready for when we finish the presentation. Okay, so I think that's all I was going to say. Thank you to Alex, who's sharing the slides. And Alex, would you mind pinning our contact details to the chat as well, so people have those to hand? And I'll hand over to Tracy, who's going to start by talking about public involvement. Thank you.
Thank you, Louise. Hi, I'm Tracy, and I work with the Specialist Centre for Public Health. I'm one of the research advisors. And I'm going to start us off by talking about public involvement and some of the basics you need to think about in your application, and also how we can support you with this. For a successful application, you need to show genuine engagement with people and communities, and that engagement needs to start early before you submit your application. Reviewers are going to want to see tangible evidence and examples in your application to demonstrate how this involvement has shaped your plans in a real way, and they're very quick to recognise when it's tokenistic involvement. You need to be clear about who's relevant and what role they play. There's an important distinction when you're referring to working with people and communities. You need to be clear that this is about collaboration, shared decision making and co-creation, and it's not about data collection. So be careful about using language associated with data collection in this when referring to involvement. So language such as surveys and focus groups, and maybe use language that's more relationship focused, such as conversations and meetings. Public involvement partners are members of your research team, and they contribute in an advisory capacity, whilst research participants provide research data, and obviously they're the subjects of your study. When appointing your public involvement members, think carefully about whose lived experience is relevant for your research. So this can include members of the public, residents, people who use health and care services and their carers, and also community and voluntary sector and faith leaders. And I'm sure in local authorities, you'll have some very strong links and networks with those groups. Those groups usually have trusted relationships with specific communities and can help broker wider introductions. Sometimes health and care staff can be included in this if they're the end users of your research, but be very clear about why their perspective is relevant. There isn't any perfect formula for this, but you need to be transparent about your rationale, and also ask yourself if there's anyone that you might have excluded. Diversity and inclusion is a high priority for the NIHR, as Lauren will explain next. The people and communities you involve should include diverse lived experiences, especially those who are underserved or impacted by health inequalities. So this includes factors like ethnicity, gender, socioeconomic status, etc. And you need to be creative and inclusive in how you organise the involvement activities. You'll need to describe how you will support your public partners and allow for appropriate induction, training, access, etc., as well as, of course, reimbursement for their time and expenses. As this is a career award, you'll be expected to manage and coordinate the involvement yourself. And depending upon your experience and confidence, you might want to bear this in mind when considering your training and mentoring needs. And you might want to include an involvement training plan for yourself to help you work effectively with communities, especially if you're interested in developing this as a research leadership skill in the future. And lastly, don't forget about how you'll evaluate the impact of the involvement, both on your research and for the people involved, plus a dissemination and feedback plan to share this learning with academic and, of course, wider public audiences. And don't forget the public feeding back to the public partners that you've worked with. Can I have the next slide, please, Alex? So what to expect when writing your application? You'll have 3,500 characters to summarise your approach in a section called Working with People and Communities. But you also need to embed details about who, how and when you'll involve people throughout your 10-page research plan. And you need to make sure that you signpost to those details from the Working with People and Communities section. Make sure you design your involvement plan with your public partners during those early meetings, because they'll know best how and when they can make a meaningful contribution and what support they'll need. By designing this together, you can ensure it's accessible, appropriate, and interesting for them. And they will also think of risks and barriers that you might not be aware of, because you want to be able to develop sustainable relationships that grow over time through your research and beyond. There are tools like the research cycle diagram. We have an online public involvement planner, and there's the UK standards framework, which can help prompt you to embed involvement in all stages and aspects of your research, including governance and evaluation. And of course, every application needs a plain English summary. This is both for your public readers, but also for academic reviewers, because there might be reviewers on the panel who are not expert in your particular field or methodology. And that summary should explain your research aims, approach, and your public involvement plans in language that a 9 to 11-year-old can understand. So make sure you avoid jargon and think about accessibility and language needs in the way you present it. And of course, you need to include a budget for involvement. So for predoctoral awards, you can ask for up to £1,000 for working with people and communities. And if you're applying for a doctoral or postdoctoral, then there's no limit, but you need to make sure you submit a proportionate budget and you'll need to justify your costs. And of course, reviewers are going to cross-check your budget and make sure that that matches the involvement activities and the support that you've outlined. And as mentioned, don't forget about your own public involvement learning needs. Can I have the next slide, please? So finally, we're here to help you, both in the Centre for Public Health and also social care. We have a very similar offer in terms of the help that is available. We recommend that you register with us early, and when you do, you'll be assigned a lead methodologist and also other specialist advisors. And if you want it, you can also ask for specialist public involvement support. We work with you through one-to-one meetings, usually virtually, and you can have as many meetings as needed up to submission, obviously within reason. And we can review drafts of your application. Both centres offer a public involvement fund, which is pre-award, and that enables you to do that early involvement that I mentioned before. In the Centre for Public Health, that's up to £350 and £600 if you can make a case. And in the Centre for Social Care, it's up to £500. Very similar application processes. We can also arrange mock interviews for you, and those include members of our Public Advisory Board. and we can signpost you to public involvement guidance and resources, because I'm very aware that it can be really overwhelming, particularly on the NIHR website, where there's so many resources and so many hyperlinks to more resources. So we can certainly help you with that. And in the Centre for Public Health, we've started a new offer, which is drop-ins, public involvement drop-ins for local authority staff. So even if you haven't started thinking about an application and you want to talk about public involvement in research, then please do book one of those drop-ins. So thank you, and I look forward to hopefully working with you in the future. And I'll hand over to my colleague Lauren.
Thanks, Tracy. We have the next slide, Alex. Fab, thank you. So I'm going to talk through research inclusion, why it matters, and why it should be in your application. So here are a few of the NIHR definitions of EDI and research inclusion. I won't go through them in keeping with time, but I thought I'd put them in so that you could either come back to them or take a screenshot. Can we have the next slide, please, Alex? So why research inclusion matters. So I'm just going to go through a few points so we can have some background on research inclusion and why we should be putting it in our applications and then doing it throughout our whole research life cycle. So firstly, it improves the relevance and impact of your work. So inclusive research ensures that findings reflect the needs and realities of diverse populations, and it makes outcomes more applicable and impactful. It can reduce health inequalities. So by involving underrepresented groups, research that helps to address gaps that perpetuate disparities in health and social care. It can strengthen evidence quality. So diverse participants enhance the robustness and the generalizability of your research and your evidence, which leads to better informed policy and practice, and also impact. It can help build trust and engagement. So inclusion fosters transparency and trust between researchers and communities, which can encourage long-term collaboration for future research projects. It also meets the ethical and funding expectations. So research inclusion is now a condition of funding of the NIHR. So it will need to be in your application for your application to be competitive. And finally, it drives innovation. So different perspectives can lead to new ideas, create solutions, and create research that challenge assumptions. Next slide, please, Alex. Thank you. So there's some other things to think about here as well as to why research inclusion matters. So we need to identify and focus on the population and geographies within that are in the greatest need. And we must challenge and change research perspectives that leave out underserved groups. We should reduce research waste by avoiding studies that don't apply to the wider population. And we need to understand whether certain groups are harmed or disadvantaged by an intervention, even if it works for most people. So one of the main examples we have of this are digital interventions. They can be great for a lot of people, but it can also be harmful for people or bring in some like digital exclusion. And then we must also prevent harm and make sure interventions are tested within a diverse range of people. Next slide, please, Alex. So I'm just going to go through a few points as to how to address research inclusion within your application. So this can be done throughout your application. You could also have a section within your application that discusses how specifically you are addressing it. But if we look at the research life cycle, in your rationale, research questions and data collection, we need to be thinking, how do your methods address participants' protected characteristics and needs? Within your selection of participants, sites and samples, we need to ensure that exclusion criteria are clearly justified and assess whether recruitment and consent processes are inclusive of underserved groups. So this could be having different types of consent processes for certain populations. For example, if literacy is low, you could have process consent or verbal consent. Data analysis and presentation. How will you analyse and report equality, diversity and inclusion characteristics? And then dissemination, implementation and impact, how will the findings be disseminated and accessible via inclusive formats and channels? And will the most people who are needed be impacted by your research? Are they going to find out what's happened in the research? So this could be maybe moving away from conferences or academic publications, but more to community events, videos, vlogs, blogs, podcasts, things like that. And then budgeting for inclusion. So it's thinking about what costs need to be factored in when designing inclusive research. And this should be in your application. I think also what's not on there is it's important to consider for smaller awards, well, for any awards, but also for smaller awards, any cost for accessibility needs too, whether that's for yourself or for people involved in your research. Can we have the next slide, please, Alex? Thank you. So this is the Research Design Service EDI Toolkit. There's a QR code on the slide there that you could scan. So I just wanted to briefly show you this. It was a toolkit that was created by the Research Design Service, which is now the Research Support Service. And it includes these 8 domains which track the whole research life cycle. So I just think it's a great thing to use while you're developing your application, and it will make sure that you consider research inclusion throughout every aspect of these domains. I think I'm handing over to you now, Laura.
I think so, yes. And I have a very exciting, splitting side that just says practical considerations, because I'm going to move us away from what Tracy and Lauren have been talking about in terms of these real gold standard approaches to designing your ideas. You can move us on to the next slide, Alex. I don't need this one. To talk about the logistics of actually getting from where you are at the minute to having put in an application for an award. So we're going to start with liaising with your employer. And I'm going to say now, I don't have any magic solutions to any challenges you might run into, but I'm going to try and give you ideas and things to think about and things to consider and possible resources where you might be able to get help, and very much encourage you to talk to us if you do run into challenges as you're working through these processes. But the first thing I'm going to say about liaising with your employer is think about what might convince them as to the value of your fellowship to them as an organisation. So as well as it being valuable to you in terms of your career development, why is it valuable to your employer to support you to do this? And you might think about things like the benefits of research activity for organisations. We see evidence that organisations that are research active are also better practitioners or work better in practice. Research involvement improves organisational performance in that way. It can help positively contribute to CQC ratings if you're involved in research. The CQC likes research. So if you're in the adult side, that's potentially really valuable. There's positive impacts potentially around staff retention, staff morale, development of practice, becoming better practitioners from the work that you're doing. Any of these sorts of ideas that might help you to pitch it and sell it to your organisation if they're not necessarily convinced. And I would say go and find the right person to talk to. Who's interested in research in your organisation? Who's maybe got it within their job remit? Who can champion you being involved internally? So it's not just you talking to the organisation, but you've got that contact point. You might have a local authority research practitioner role. You might have a research lead. It might be, I know in social care, some of the principal social workers have research within their remit as a consideration. So do some investigating, find out who your potential allies are within your organisation and talk to them. Get in there early for problem solving any potential barriers. And some of these barriers might be logistics. So talk to your finance departments, talk to your HR departments about what they would need, what they would expect, what information they need to understand what you're doing and to make it a reality. If you're running into questions from finance, HR, the organisation in general, and you don't really know how to address them, ask for help. Yeah, reach out to possible sources that might have some ideas for solutions or might have run into this kind of situation before. The hint I'm giving you there is to come and talk to us. Yeah, contact us at the Centre for Public Health or the Centre for Social Care. And go into these conversations well prepared. Yeah, don't just sort of stick it in on the fly at 4 o'clock in your diary because you just happen to have a space. Make sure that you're confident in your knowledge about the award you want to apply for, what that might mean in terms of your practice availability and backfill for posts and your rationale for why you want to apply. Assume that your organisation doesn't know. Because one of the things we've seen is that even in organisations that are quite research active, like the NHS, people still have to have these conversations with particular individuals because the organisation might be research active, but particular managers or practitioners might not be. And to help you with that, don't assume that you're on your own. Yeah, reach out to other people, learn from others. Do you have any local contacts? Is there anybody within your authority that's already applied for an award? And gone through this process that you can pick the brains of. If there's no one in your area, is there anyone elsewhere in the local authority? Work across your regions. If you're public health, reach out to social care. If you're social care, reach out to public health, see if anyone's done it from the other side and if they can give you hints and tips because you're dealing with the same organisation. There is also, and I know Scott is lurking in the chat somewhere and hopefully can provide the link to this. There is also a peer support network for people who have applied for or are currently applying for or who are interested in applying for fellowships. And that includes monthly meetings where people get together and talk, and there's expertise in that room you can draw on, where you can also potentially get ideas from how other people's local authorities or organisations have responded. Can I get the next slide, please, Alex? I'm thinking then logistically as well about the costs of your fellowships. Again, and this is a theme of my thing today, think about it early, ask about it early, find the right person in your finance team as one of the first things that you do so that you can be clear about what they need. Because we all know local authority processes take time. You can't always rush things. It's got to go through the right people to get the right information. And you don't want to be doing that at the end, really stressed as your deadline is looming. Bear in mind, this kind of work is not necessarily core work for your authority, especially if no one in your authority has applied for one of these before. So they might need help to understand what a fellowship means and how that might translate into their existing processes, their existing financial models, and their approach. And when you're thinking about your costs, be comprehensive. What are the full and realistic costs of the work? Make sure you get explicit understanding from your local authority about what they will and won't fund and what they would expect to be funded externally. We know we've heard accounts of people who've tripped up because they've assumed something like travel will be covered under their normal processes, and then the local authority has said, well, we're not paying for travel for the fellowship. So make sure that you're very clear about what you need to cost in so that you're not ending up in a situation where there's no money to pay for an essential activity. So think about training costs, any resources you need for your project or your development plan. What resources do you need for public involvement and travel? I've put it on there. Clearly that one was in my head. Make sure on that you're clear about what costs are eligible. Double check the guidance, read through the guidance again. If it's not clear or you're not sure, reach out and ask for help. You can talk to us at the specialist centres, but you can also contact the Academy directly if there's a very specific logistics question that you want to clarify about what's written on the website. If you've got potential costs which are not eligible, consider how you are going to cover or work around those. Are there resources you can access from elsewhere? Is there anything you can get to through your academic supervisors or through your employer if it's not going to be covered in the fellowship? And again, talk to previous applicants about how they costed to see if there's anything that potentially you've missed or that or you can learn from their mistakes if they also missed it previously. Next slide, please, Alex. And lastly, then thinking about sponsorships and approvals and getting everything signed off. And oh, look, the first piece of advice, once again, is think about this early. Don't be looking for the people that you need at the absolute last minute. This is a piece of feedback I've had from about 3 or 4 applicants who've successfully gone on to their awards, but the big stress of trying to get sign-offs at the end when they'd left it sort of towards the end to get the sign-offs sorted. So be thinking about who is the right person in your local authority to agree what you need to do. In order to apply for your fellowship, do you need senior strategic sign-off? Do you need local operational sign-off? Is it down to your immediate manager? Do you need both? Who needs to actually give the nod for this? And in that questioning, check whether there are potential barriers to navigate, such as around backfill and local availability and things like that, that might need time to discuss and resolve so that you can proceed with your application. So again, start those conversations from the beginning. Be clear as well about the support you need from the local authority, because it's a bit more than just a nod of approval, yeah, sure, do your thing. Actually think about who is going to write your statement of support. Who's going to convince the funder that your local authority is a space worth investing in, as you convince them that you're a person worth investing in. Remember what I said earlier on about finding your local champion. Yeah. Again, this person, they might be the person to do that, or they might be the person to help you facilitate getting that right sign off in place. But you're thinking about how the local authority demonstrates that it's committed to your research development as well. So look for, have you got relevant local policies around research or strategy statements or any sort of internal commitments or internal activities that point towards research engagement in your context that you can use to help draw on to just make a stronger case there? I think that is actually the end of my slides. Will you move us on one, Alex? Yeah, so we've got our contact details there. With all of that, with questions about any of those sort of logistics things, those are equally things you can reach out to us about as well. If we're not the right people to talk to, we'll point you in the direction of the right people to talk to. There isn't a wrong door to ask for help. But please do ask us, and please do ask us early, because the earlier you ask us, the easier it is for us to help you. Our teams are great. People will pitch in at the last minute to support you as well. But if you ask us last minute, we end up rushing too, and then we can't be as comprehensive as we want to. And I think at that point, 1 minute to 1, Louise will be very proud of me. I think we can open the floor to questions, can't we, Louise?
Yes, time to perfection, Laura. So thank you. Thanks very much to Tracy, Lauren and Laura for those really helpful presentations. So there have been a few questions in the chat, most of which I think have been picked up. So if yours hasn't, do please shout out, either put your virtual hand up or just switch your camera on, or just shout out and ask it. I'm just quickly going through to see if there are any that I think we haven't really responded to. I know there was an early question about the sort of degree of public involvement that's expected at pre-doctoral level, and I think you responded to that in the chat, Laura, that it is sort of proportionate, and you don't get the 10-page to write your research plan in your pre-doctoral. As you know, you write a sort of area of interest 1-page outline, but there is still an expectation that you will have considered public involvement. So I don't know whether you wanted to say anything more to that, Laura or Tracy or anybody, but I just we know it's one of the things that's scrutinised at panel along with the inclusion, though, so it's really important that it's in there, and often it can be an important thing to get some training around if it's something you've not already done.
Yeah, sorry if I'm misled by referring to the research plan, but as you've already said, it needs to be proportionate, and at pre-doc you can also only apply for up to £1,000, which isn't an awful lot, so that gives you some gauge of how much, but it's thinking about perhaps your own development needs, and really an opportunity to start building those relationships very early and finding partners in the communities that are relevant to the research you're going to be wanting to develop, I think.
Yeah, I think for me, the pre-doc, the hint is in the name. This is your Predoctoral Award. It's about what do you need to build towards doing a doctoral award and doing that piece of research. And you want to be doing that piece of research in partnership with, not to the sort of the population that you're in. You know, it's that classic phrase that I know we're very familiar with in social care. Yeah, you know, nothing without us, nothing about us without us. Yeah, actually we do with, we don't do to. So it's thinking about at pre-doc level, how do you start doing that groundwork? How do you start building that public involvement into your work so that it's already seeded in and threaded through by the time you come to apply for your doctoral award?
Yeah, and so the pre-doc gives you that opportunity to start building the relationships and to make sure that your research that you would subsequently do as your PhD is informed by the public or patients, if that's the case. I'm not actually seeing any more questions in this chat unless I'm missing them. Is that it? Does anybody have anything else that they want to ask while we're here? I think we're all on message with the come early, start planning early. I think that's come out, you know, in all the webinars we've done. So both in terms of, you know, planning your public involvement, thinking about being inclusive in your research, and the negotiating with your employer. And you know, Laura, you indicated it's a much more well-worn path through the NHS, and there's a lot of learning still in local authorities, but even within NHS trusts, it's not always straightforward. So I think the advice to start that early is really important. And as you've said already, but do come to us, and if we don't know how to support or how to help, we can find someone that can, because we're building a network of people that have walked this path, so we can help to link you up and get some advice. Can you use the RSS for career? Oh yes, somebody's answered that.
I was straight in there, Louise.
You were in. When does the Predoctoral Awards open and how often? So Predoctoral is only once a year. We're expecting it to open, I think January to March it's usually open, isn't it? Am I remembering correctly?
Yeah, the indication from the Academy is that it would be early in January.
Oh, they did. They said so.
Yeah, they said
yeah.
keep an eye out for it early in January for the pre-doc.
Yeah, so previous years it's been quite near the end of Jan. I think it was the 29th last year, but they have indicated it might come out earlier this time. So yeah, keep an eye. We'll publicise it on our LinkedIn and through our newsletters and so on when they release those dates. So we'll also keep you informed. Anybody else? The up-to-date guidance for the pre-doc. Well, the only guidance we have is from last year's call, which is now closed. I can find the link to that and put it in the chat though. But I think I'm right in saying it was a one-page sort of area of research interest with a pre-doctoral. I'm on one screen, but I'll try and find it. Here we go. In fact, I've got it open handily. Oh no, that's postdoc, sorry. I'll maybe put it in the chat later on when I find it, and able to look at the other questions. How
long before the deadline would we suggest contacting? Do you have an idea now? Now. There isn't a long wait for support on our side. We get back to people as quickly as we can. There might be a bit of diary coordination involved in fitting practitioners' diaries around academic diaries to actually book your appointment in with your advisor, but we get back to people pretty quickly. But actually, if you've got an idea, why not just get in touch now? Because you can talk us through the early stages of your idea. We can give you steers on where to go and the things to think about. And you can then move up. You don't have to come to us with, here is my plan that I'm ready to go. Come to us with your initial ideas and we'll help you develop that into a ready to go plan. Because it's not I can't remember who mentioned it, Tracy or Lauren did, you know, it's not you get one session and that's it, you're done. You can come and talk to us and then go off and do some stuff and then come back to us with your next round of questions and go off and do some more development work and come back to us again. So you've got that ongoing support option. Sorry.
No, absolutely. I was just going to agree and to say, you know, it's never too early to come, and we, you know, don't feel like you need to have a really well formulated idea before you come, we can help you work with that and shape it. So do come early. I've found the link to the pre-doc, so it is in the chat now. Which is it's last year's guidance, but we're not anticipating it will change this year. As far as we know, it will be much the same. Scott, thank you. You've put a link to the Futures NHS link that you've put in. That's the. Do you want to say something about that, Scott? Are you on? Because that's a group that you're very much involved in organising, I think, isn't it?
Yeah, it's a space that's been.
Spot.
That's fine. I'm used to it, Louise.
Oh, there you are.
That's a space that's been set up by NIHR for colleagues from local authority who are thinking about applying for a personal award or have one. As part of that, one of my peers, Lucy Jacobs, also organises a monthly peer-to-peer drop-in on the last Friday of the month for local authority colleagues. And those are incredibly useful to hear from current awardees, but we also have guest speakers. So if you are in a local authority, you are thinking about applying, or you have an award, you really need to be on that forum.
And they follow that link to join. Is that the way to get
They do,
access?
yes.
Yeah,
Yep.
Great. Thanks, Scott. And so that's a really good place to get, share experiences and hear from other people who've kind of gone through the process and know some of the ins and outs and things that might trip you up and top tips and so on. Okay, I'm not seeing any more questions, so unless anyone wants to raise a hand or put something in the chat, we've still got a few minutes if
Yes, I'll also say if you don't want to ask your question here or you think it's a bit specific, get in touch.
yeah, absolutely.
Yeah, you can contact us if what you've got is a specific question, because someone will get back to you to answer that specific question, and if that's all you need, that's fine too. We're pretty flexible in how we support people.
Absolutely, that's the message we really want to give. Our door's open and we're here to support in whatever way you need. And that sometimes there are these very specific questions about your circumstances and we might need to speak to the Academy about that, but we can do that with you or on your behalf.